Now then, we have seen that the hypothalamus is the real master endocrine gland because it controls both the anterior pituitary as well as the posterior pituitary. Now let's talk about this small but very important gland located in the brain, but very important with respect to its secretion. So where is this pituitary gland located? Okay, so your skull has a bone called the sphenoid, and the sphenoid has a cavity which is called as the sella turcica. It looks like the saddle of a Turkish horse, and within that is located the pituitary gland. So the pituitary gland is located in the sella turcica of the sphenoid bone of the skull, just behind the optic chiasma, where your two optic nerves cross each other. That's called the optic chiasma. And the pituitary gland is present just behind the optic chiasma. So you have the hypothalamus, and the pituitary gland is just below the hypothalamus. So this is the hypothalamus. This is the pituitary gland, which is present just below the hypothalamus, connected to the hypothalamus by a stalk, which is called as the infundibulum. And it is located in the sella turcica of the sphenoid bone of the skull. The pituitary gland is divided into two parts, the anterior pituitary and the posterior pituitary. The anterior pituitary consists of the pars distalis and the pars intermedia. In the case of human beings, the pars intermedia is merged with the pars distalis. But in other lower vertebrates, it's a separate part. So in general, in vertebrates, lower vertebrates, the pars intermedia is a separate part, secreting a hormone called melanocyte stimulating hormone, which helps to increase the pigmentations on the skin. But in human beings, MSH is secreted by pars distalis only because the pars intermedia in humans is merged with the pars distalis. The NCRT based hormones that are secreted by the pars distalis are growth hormone, prolactin, adrenocorticotropic hormone, thyroid stimulating hormone, follicle stimulating hormone, and the luteinizing hormone. So this highlighted part, this highlighted part over here is the anterior pituitary. This is the portal circulation, the hypothalamo-hypophyseal portal vein. These are the neuroendocrine cells which of the hypothalamus. They secrete the releasing and the inhibitory hormones, which act on the anterior pituitary, and the anterior pituitary then secretes the hormones we spoke about. The posterior pituitary is under the direct neural regulation of these hypothalamic hormones. This is the infundibulum. Axonal parts pass through the infundibulum and the knobs end into the posterior pituitary. So, briefly, the anterior pituitary secretes growth hormone, which is called as the somatotropin hormone. Under the influence of the growth hormone releasing hormone, its secretion is stopped by the growth hormone inhibitory hormone. Growth hormone stimulates and brings about the overall growth of the body. It increases the linear bone length. It increases the muscle mass. It increases the good body weight and many other functions. Prolactin stimulates the mammary glands to secrete milk for lactation. Prolactin acts on the prolactin acts on the milk secreting cells of the alveoli and causes it to secrete the milk during lactation. As pregnancy sets in, it also helps in the development and the enlargement of the breast, filling it with the milk alveoli. Then the adrenocorticotropic hormone acts upon the adrenal cortex, and then the adrenal cortex will secrete the different hormones like glucocorticoids, mineral corticoids, and sex corticoids. Thyroid stimulating hormone acts on the thyroid gland. Then the thyroid gland will secrete its hormone T3 and T4. The follicle stimulating hormone FSH and the luteinizing hormone LH together are called as the gonadotropins. Follicle stimulating hormone, both in males as well as in females, helps in the gamete production. In the case of females, follicle stimulating hormone acts on the secondary and the tertiary follicles and causes the release of estrogen in female. And estrogen is responsible for development of secondary sexual characters in females. LH, luteinizing hormone, in females causes ovulation. It maintains the corpus luteum so that the corpus luteum will secrete progesterone, and through progesterone, pregnancy will be maintained. In males, LH acts upon the interstitial cells of the testes and causes the secretion of testosterone. So, these are in brief the functions of anterior pituitary hormone that you're supposed to remember. The posterior pituitary, it releases oxytocin. Oxytocin causes strong uterine contractions and causes parturition, that is childbirth. That is why oxytocin is also called as the birth hormone. Oxytocin is also responsible for milk ejection. It acts on the myoepithelial tissue of the alveoli of the mammary glands and it causes the secretion of milk. Secretion, I meant over here, ejection of the milk from the mammary gland. Okay, because the secretion part is done by prolactin. Oxytocin will act on the myoepithelial cells, cause their contraction, and will cause the milk to be ejected through the lactiferous duct into the mouth of the infant via the nipples. So it's a milk ejection hormone. It helps in the release of milk. Vasopressin, which is also called the antidiuretic hormone, it acts on the distal convoluted tubules of the nephron and the collecting ducts and causes the reabsorption of water. Thus, the urine becomes hypertonic and the water gets conserved in the human body. Vasopressin also acts on the blood vessels and causes this vasoconstriction, decrease in the diameter, thus increasing the blood pressure. Many of these hormones, many of these hormones, they are required in trace amounts, minute amounts. अगर इनका अमाउंट ज्यादा हो जाता है, then the person suffers from hyper secretion disorders. और इसका अमाउंट अगर कम हो जाता है, then the person suffers from hyposecretion disorders. जैसे for example, let us take the example of growth hormone. The growth hormone undergoes hypersecretion during childhood. The child will become excessively tall, and such a condition is called as pituitary gigantism. Such a condition is called pituitary gigantism. After the growing years are over and the epiphyseal plates have already fused, मतलब epiphyseal cartilage use up हो चुकी है, growing points close हो चुके हैं, the age has crossed maybe 19, 20, adulthood onset has occurred, and then the growth hormone ka secretion increases, maybe because of a pituitary tumor, and now there is a hyper secretion in adulthood that will cause a condition called as acromegaly, a disproportionate giant who will show an abnormal growth of the bones with a prognathic jaw, a long jaw, a forehead that has come out, sometimes kyphosis, a hunchback, irregular growth of the bones, and the symptom onset occurs very late. So it's very important that these conditions or this condition, acromegaly, has to be detected early. Late detection can sometimes be even fatal. It can affect the bones of the thoracic cage, affect the breathing, and if it is a pituitary gland tumor, it is anyways dangerous. So all these hormones are required in trace amounts, but their increase causes hypersecretion and their decrease causes hyposecretion disorders. If growth hormone is very low during childhood, the child will not be able to attain the correct height and overall growth and development, which is called pituitary dwarfism. Even with the last hormone that we saw, vasopressin, if there is hyposecretion of vasopressin, that is ADH, the urine will become very dilute, resulting in the condition which is called as diabetes insipidus. So, this is the quick, brief understanding that you need to have and remember about the pituitary gland.